Arianne here from the Movement Paradigm. Today I'm going to talk about a topic that is near and dear to my heart, which is cancer. So my brother sadly passed away at the age of 29 from cancer. My mom also had breast cancer, and I had liposarcoma about 4 years ago. So obviously this is something that has grown very prevalent in my family and has caused me to really look inward, look outward, look at all of the reasons why this could have potentially happened to my family. So one of the questions that was posed about 20 years ago by the American Cancer Society is there a cancer-prone personality? At that time, there was not enough data, there was not enough studies to show whether or not certain personality types would correlate with being at risk for cancer or recovering from cancer. However, at this time, there is a huge field of study called the field of psychoneuroimmunoendocrinology that looks at how your psychology, your nervous system can affect your immune health, your hormonal health, how all of these systems work together to determine, are you likely at risk for disease, in this case cancer, or are you likely to be able to recover from this? So, with that said, they have determined that there are, in fact, cancer personality prone people and cancer resistant people. Of course, just like anything else, this is not black and white, and just because you might fall into these characteristics does not mean you're going to get it or you're not going to get it. However, I do think it is really valuable information to look at, are these some of your characteristics, and does this mean that you could potentially be prone to cancer? And of course, how can you prevent this? So some of the characteristics that are in a cancer-prone personality type. The first and foremost is going to be a person that represses or suppresses positive or negative emotions. So repression, I always like to think of, if you were angry with someone from 20 years ago and you totally forgot that you were angry with them, and every time you saw them, you had a great relationship with them, everything was fine. That would be something where you had this repressed anger for 20 years, but you just blocked it out and never really addressed it. Let's say you were suppressing those symptoms. So you recognize that you're angry with this person, but you still continue to be pleasant and have a great relationship with them. So both of those can be a huge factor in disease. So keep that in mind, and that doesn't necessarily mean cancer. So some other characteristics would be showing anger, resentment, or hostility towards others. So some of these might seem a little bit more obvious, is that sometimes people with these characteristics can be more prone to some type of disease. Taking on extra duties and responsibilities, even when they cause extra stress. So the person, it might be you, and you just keep taking on things. No matter, you're trying to please everybody, so you want to make sure you do a good job, so you just keep taking on more responsibilities until you really can't handle it anymore. Reacts adversely to or does not cope well with life's changes. So the ability to be resilient to life's ups and downs, being able to bounce back to your normal state as quickly as possible. Is negative or pessimistic, becomes easily depressed or has feelings of hopelessness, worries often and excessively about others, feels the need for approval or to please others. I already mentioned this, but this is a really, I think, a very common one. I personally have had issues with trying to do everything, trying to please people, and repressing symptoms or repressing emotions. When my brother passed away, I dove into work, and I had a business at that time, and that's all I focused on, and I didn't really grieve, properly, if you will. I don't think that's necessarily a term, but I didn't really allow myself to grieve what was happening. So I've learned later in life that how important that is to be able to express your emotions, be able to learn how to cope with daily challenges and huge life obstacles. So a cancer-resistant personality type would be expresses emotions in a positive and constructive way, controls anger and resolves anger issues positively, knows when to say no, copes well with stress and feels in control of situations, is optimistic and hopeful, does not easily become depressed, and seeks out and maintains social networks. So again, this is not black and white, but it is, I think, a really important way to look at this, and not necessarily just as it relates to cancer, but because everyone that's watching this video knows at least one person that has been touched by cancer, I think it's very, very relevant. And the one thing I want you to take away is it doesn't matter which list you fall into, that I want you to think of, what can I do about it? So if some of these things are things that you experience on a daily basis, then how can you learn how to cope differently? How can you learn how to express your emotions? Is that speaking to a psychologist, psychotherapist, a counselor? Is that working on mindfulness and meditation techniques? Is that expressing your body through movement? There's so many aspects that can really help you to prevent cancer, but then to also recover from it. So I'm a huge believer, a lot of you know my story, but I, put mindset, nutrition, and movement to the test when I was in treatment. I trained for American Ninja Warrior. I worked every day. I traveled. I did everything that I wanted to do, and I thrived during cancer treatment. And doesn't mean that that's for everybody, but I do believe that, really trying to learn how to manage these symptoms is going to help you be able to recover and then hopefully prevent it from coming back. So enjoy. Have a great day.